Well, in the role that our community nurses have, I think it's really important, because when we have talked about death and dying with those we support, it can actually bring about peace and comfort, not only to them but their families, that there has been an open and honest conversation. There are so many aspects to having that conversation about death and dying. For example, in our role, at some point we will ask the question, where would you prefer to be? You know, would you like to avoid being at home? Would you like to avoid being in hospital? Who would you like around you? Do you want to have only close family members there? Do you want to be on your own and die peacefully without anyone present? Or would you like your absolute closest friend to be there holding your hand, not even saying anything, just being a presence? Is that what you'd like? And it just makes a difference for everyone to be on the same page and know exactly what that person, who is the most important person in all of this, that they know what they want and they've been able to express it, difficult as it can be.
The most common questions are how to tell a child or young adult, when to tell them, and how to go about telling them. And in my experience, I think from working with families and with patients, it's down to, it can be an individual basis, as in they know their child and they know how to approach it with their child. I would say though, being honest is very important when telling a child.
My advice really always is to be direct, to use the language of death, not to be afraid of it. And mostly people will respond to that directness with relief and gratitude that we're not hiding. And certainly in a hospice, if we can't use the language of death and dying, then we're getting it wrong. You know, it needs to be our language, and to help people find their own words. Because although we're used on a day-to-day basis of talking about dying, about the language around funerals, for most people it's the first time this has been encountered. So our role is very much to support people with finding their way of talking about it.